Are you asking the right question? How do you then access the right data? How do you now use it to make decisions? So our first case is a really like one-man show almost organization. It was the founder with a team of volunteers. They worked on eye care. And the problem statement really was, I have all my information in patient case files with no way to make any sense of it. So really what they were looking for is, how do I now understand impact and how do I then demonstrate impact? And what we did, I think this will be pretty familiar to most people, is plotted out how we expect outcomes to occur. And hence at each point, what are some indicators that would be useful? What is the data that would be required? And tried to keep it really light and simple. The idea was not to overwhelm the data management in a way that the entire case file had to be useful. It was, what are we really looking to answer? We then constructed really a simple data entry sheet where it's a Google sheet, no cost involved whatsoever. As long as you have, again, really good clarity on what you're trying to measure, you've set up drop down so that the data quality is really well controlled. This sheet in itself was a wealth of information, and you didn't need to then look at a large case file. We created visualizations on something called Data Studio. It's now Looker, but owned by Google. Again, free to use, open source, all of these solutions. So we often use Metabase, we use Superset. Different solutions come with different pros and cons, but they'll get the job done. So in this case, there was sort of different tabs that showed the organization where they were at. What could they do really? They could understand the complexity of cases. I think that's what they often struggle to communicate, that it's not just about one surgery. Sometimes someone has several other health conditions that really complicate it. They were able to look at, why should the same treatment cost differently for me or you, depending on our, complexity of our case. They were also able to go back and negotiate with hospitals, based on, okay, in this geography, we're sending them so many patients. So what it did for the org is really help them use that information in a meaningful way